So our lecture today is odontogenic infection of the soft tissue. Actually, the infection in the oral cavity either could be of odontogenic or non-odontogenic. Odontogenic infection usually arises either from the pulp or from the periodontium, the structures surrounding the tooth. Sometimes this infection also might be associated with infected cystic lesion or odontoma or even dental implants. But sometimes also the infection could be associated with structures outside the oral cavity. For example, could be infection of the maxillary sinus, or could be the infection of skin, might be also spread to the oral cavity. Sometimes also the infection or certain infections associated with systemic condition might be also spread to the oral cavity. So in this lecture, we are going to discuss the odontogenic infection. The odontogenic infection in the oral cavity usually present in the form of oral abscess or could be cellulitis. Here, we are going to discuss dental or oral abscess. Abscess, by definition, is cavity filled with pus. And dental abscess could be in the following types: acute alveolar abscess, or what we call acute periapical abscess, acute periodontal abscess, acute pericoronal abscess. The abscess also could be associated with odontoma, cystic lesion, and implants. Even sometimes it might be associated with foreign body, or could be, as I mentioned before, maybe spread from other region or from maxillary sinus or from skin, and so on. And this is actually, it is of non-odontogenic abscess. Now, let us start with acute alveolar abscess, or what we call acute periapical abscess, which is most commonly used. Here, we are going to discuss the causes of acute periapical abscess, that means how periapical abscess develop, clinical course of periapical abscess, which include the following stages: acute apical periodontitis, periapical granuloma, which is chronic infection and usually considered as defense mechanism to combat or to prevent the spread of the infection. Or could be in the following in the acute alveolar abscess, which is the abscess or what we call periapical abscess. Now, let us start with the causes or how or the pathogenesis of the periapical abscess. Usually, the dental pulp get infected. The dental pulp infected either from carious lesion, because the bacteria situated within the carious lesion, or sometimes during cavity preparation there is pulpic exposure and the pulp contaminated with oral microflora or oral microorganisms. So this is actually bacterial infection of the dental pulp. Sometimes, however, the dental pulp might also be infected due to or get necrotic. The pulp get necrotic or gets necrotic due to thermal or physical or chemical factors. So in case of polishing, the heat generated during polishing, this may transmitted to the pulp, and this causes pulp necrosis. But the infection, I mean the bacteria, reaches to the dental pulp in this condition from the periodontal lymphatic channels. So dental or pulp necrosis either could be of bacterial origin in case of carious lesion or pulp exposure, or could be of non-bacterial, as in case of the exposure of the pulp to thermal or physical or chemical trauma. So the infection spread to the pulp, and the pulp gets infected. Now, if there is no treatment of the pulp, in this case, the pulp gets necrotic, and pulp necrosis occurs. In this case, the root canal or the pulp or the bacteria might be spread through the root canal to the region of the periodontal ligament, causing infection of the periodontal ligament and inflammation. In this case, if the periodontal ligament infected, in this case, it is swollen. There is swelling of the periodontal ligament. In this case, the tooth becomes sensitive, tender to percussion, and the patient cannot bite upon the tooth, and even there is severe pain. And this clinical condition, it is called acute apical periodontitis. If acute apical periodontitis does not treat it, in this case, the infection might spread beyond the tooth through the apical foramen to the periapical region. Here, this is the periapical region. Actually, the periapical region here, this is cancerous bone. But the infection does not spread through the cancerous bone because the body will form what we call pyogenic membrane to compact or prevent spread of the infection toward the cancerous bone. Rather, the infection might spread laterally toward the cortical plate. So if the infection spread toward the cortical plate, pressure causes resorption of the cortical plate and perforation, but still the abscess beneath the periosteum. That means the infection is still within bone. In this case, as a reaction of this infection within bone, there is what we call collateral edema, and characterized by severe pain and the swelling usually tense and hard. So this is what we call collateral edema. But once the abscess penetrates the periosteum and spread within the soft tissue, actually the intensity of the pain decreases, and also the swelling will be situated within the soft tissue surrounding the tooth. And in this case, there is fluctuation. That means the swelling not intense or not hard, but it becomes fluctuated. So there is fluctuated swelling within there is redness, swelling, and the swelling is a fluctuation because of the pulse within the soft tissue. Sometimes, if there is no treatment, the pus may be spread through the soft tissue, and this is called what we call will form what we call sinus tract. When the pus releases through the soft tissue, through the oral mucosa, for example, in this case, what we call sinus tract. So this is the cause, or what we call the pathogenesis. Infection of the pulp necrotic, then spread. If the immunity is good, and also the virilence of the microorganism less, so in this case, periapical granuloma might be developed or might be established. But if the virulence of the microorganisms and the immunity is decreased, so in this case, the infection might spread to the periapical region, but rather than to spread through the cancerous bone, it may spread toward cortical plate, resorption situated beneath the bone, beneath the periosteum, and within the bone, so there is what we call collateral edema. But once the pus penetrated the periosteum and spread toward the soft tissue, in this case, it will cause redness, swelling within the oral mucosa, and this is what we call periapical abscess. Sometimes it may penetrate the soft tissue, leading to what we call sinus tract formation. So this is the acute alveolar abscess. The clinical manifestation, usually there is severe pain, actually, and there is swelling, redness, and swelling within the labial. Could be this swelling, could be labially, or could be palatally. Palatally usually associated with the palatal root of upper molar, or could be with the inclined root of the lateral incisor. So these are the source of the abscess in the palatal region. Labially, which is actually most common abscess, found as swelling in the labiobuccal vestibule. There is redness, there is also pain. Lymphadenopathy could be associated as well. Here, as we can see, that the abscess might penetrate the soft tissue and give what we call sinus tract. So management of acute alveolar abscess, either by pulpic extirpation, particularly or especially in case of acute apical periodontitis. The pulp should be extirpated. The canal should be opened, excess opening. This is to release the pressure within the root canal, and even sometimes the patient may or the pain may relieve. And also incision and drainage in case of there is abscess within the soft tissue, incision and drainage. Actually, pulpic extirpation in case of single-rooted teeth may be more effective to relieve the pain and also to subside the condition. But in case of multi-rooted teeth, sometimes also we need incision and drainage. But actually, incision and drainage, it should be done usually in case of there is abscess. Sometimes tooth extraction, if the position of the tooth is not strategic or it is badly carious, in this case, tooth extraction, antibiotics and analgesics also should be prescribed. Now, acute periodontal abscess. Acute periodontal abscess, actually, this abscess usually situated in the lateral side of the root. That means it is situated laterally. From its name, acute periodontal abscess, which is lateral situated. Because this is, or the cause of this abscess, it is not pulpal cause. It is due to presence of what we call periodontal pocket. So bacteria in the gingival crevice get access through the periodontal pocket to this region and establishing what we call